There are currently 9,000 patients with coronavirus in hospitals across England, which means they're occupying around 1 in 10 beds. 1 in 4 doctors are understood to be off sick or self-isolating. An entirely new hospital, built in a conference centre from scratch in just a week, will be ready to take its first patients in just a few days. The Nightingale Hospital in East London will be ready for 500 coronavirus patients, rising eventually to 4,000. At that size, it would be the biggest hospital in the world. It's the first of a number of new facilities being built around the UK to take the pressure off existing hospitals. 1,408 people are now confirmed to have died from the virus in the UK. That's an increase of 180 people since yesterday. Our health editor, Hugh has the latest.
Just a week ago, it was a giant conference hall with room for a dozen football pitches. Now it's a hospital with intensive care beds and ventilators and ready in a few days' time to receive the first patients. The capacity eventually will be 4,000, and if those beds are used, it'll be the biggest hospital in the world. Sir Simon Stevens, head of NHS England, toured the site at London's Excel Centre today as it was announced the number of patients was increasing by 1,000 a day.
Today there are over 9,000 positive coronavirus patients in hospitals across England, and we know that number is only going to increase. That's why what you see here is a mass mobilisation taking place right across the country, but also at these new Nightingale hospitals. This has been an extraordinary team effort on the part of nurses and doctors and therapists and pharmacists across London, but also volunteers and paramedics and people returning to help.
The first staff were applauded in today. Volunteers from other hospitals and recently retired doctors and nurses will be caring here for seriously ill COVID-19 patients at what's now called the Nightingale Hospital.
So it was an Arctic lorries here last Tuesday, Wednesday when I was first here, and now we've got fully ready to take some patients. Now there's still a lot more work yet to be done, but huge progress about building a hospital in London, Nightingale London, in just less than 2 weeks. It is unbelievable.
This is what the hospital could look like when it's finished, with thousands of beds and a mortuary. Army staff are working with the NHS team to make it a reality. It's in the heart of London's Docklands with business hotels all around. And the fact that they've transformed this conference centre into a giant hospital so quickly shows how serious they think the pressure on the NHS could be. Birmingham's National Exhibition Centre will house a Nightingale Hospital, so too the Central Convention Centre in Manchester. The SEC in Glasgow will also become a temporary hospital in 2 weeks' time, with space for up to 1,000 patients. The Principality Stadium in Cardiff is set to be used as an NHS field hospital, and in Belfast a coronavirus assessment centre will open this week. There may be plenty of new hospital beds, but staffing is a problem, with one estimate that a quarter of doctors are off with the virus, or because a member of their household is unwell.
I've been off work for a week now because my partner had a temperature last Monday, so I self-isolated like you're supposed to do. But I've been feeling really fine. I had a very mild cough last week, so I probably did catch it, and by the rules, had I been able to be tested soon enough, I could have proved that and gone back to work after a week of isolation.
Freelance health workers known as locums are frustrated because they feel they don't have adequate legal and financial protection.
It is vital that the government protect us and give us all of the equipment, and that includes both sick pay and workers' protections, as well as the kit that we need to be able to do our jobs to the best of our ability.
The lack of protective kit is still said to be a problem by some doctors, nurses and care workers. Most are anxious about what the next weeks will bring. They know that this new hospital and many others could fill up quickly with very sick patients, some of whom will not survive their stay. Hugh, BBC News at the Nightingale Hospital in London's Docklands.
Well, the social distancing that we're all enduring is having an effect and has reduced the number of contacts between us all in the last week. The Chief Scientific Advisor, Sir Patrick Vallance, says he still expects the number of infections and deaths to rise over the next 2 to 3 weeks, but the number of infections is not accelerating at the moment, and Sir Patrick urged us all to continue to stay home. Here's our political editor, Laura Kuenssberg.
We've got Oscar Mays, give me a wave, and then we've got Sebby Mays, give me a wave.
Stretching into the distance.
You're missing your friends, aren't you? But but you'll be okay, won't you? Right?
This could last a lot longer than the Mays family, now daily 5K.
They're missing out on so much school, but they are young, and I think it's just important to teach them to be resilient, really, and to deal with whatever situation they're faced with. So we can cope.
Even the Prime Minister's chief advisor, pictured rushing out of work last week, is now at home with symptoms too. The new government's routine today was a progress report on how the country's coping with the severe limits on our lives in place for a week.
This is a united national effort, and the spirit of selflessness shown by so many is an inspiration.
The chief scientist's slides capturing the huge behaviour changes we've made in the last 7 days. Look at how the use of public transport's fallen off. The number of cases of the virus rising, but maybe at a slower rate.
The measures are in place, they are making a difference, they are decreasing the contact, which is so important to spread the disease, and we're doing a good job at cutting that down. Now, the reason that's important is because, of course, it then prevents the number of cases.
Based on what you know now, are the restrictions working?
What we know is that the measures that have been taken are having a very big effect on contacts. And I showed you the data on transport. You can see dramatic reductions in the amount of transport being used. You see dramatic reductions in footfall. We know, of course, that things like restaurants and pubs, which are places where people aggregate, have been closed. So we are seeing a big change in contacts. That is predicted to have a very significant effect.
And Foreign Secretary, you're asking a huge amount of the public. Is it the government's view that people need to be willing to follow these restrictions for as long as 6 months, if that's what it takes?
The more members of the public, as they're doing increasingly, follow this guidance, the quicker we'll be able to get into a position where we review whether and how there is any easing of those restrictions.
But any rollback is still likely to be at least 3 months away.
We always understood that they potentially required to be in place for a very long period of time. So this period of 13 weeks has always been one we've understood, and clearly we keep that under review.
And whether it's easing the limits on us leaving home or schools reopening, when it eventually comes, it could be piece by piece.
We may need significant restrictions for longer than the original 3 weeks. And beyond that period, there will be time when we don't just go from everything being restricted to nothing being restricted.
Here's me standing, walking round my garden.
Routine's the key to coping, for 80-year-old Hector Woodhouse in Linlithgow at least. But he has another piece of advice as well.
I can keep myself fairly busy with one thing or another, but for 6 months, you've got to try and keep up your sense of humour, I suppose.
Laura Kuenssberg, BBC News.
Our health editor Hugh Pym is with me here. Hugh, we could all do the sense of humour, I think, at the moment. I mean, just listening to Sir Patrick Vallance, there are signs of some very cautious optimism this evening. And, of course, this new hospital in London is a hugely impressive achievement.
Well, that's right, Fiona. Very impressive going there today. Comparisons have been drawn by some with that hospital in China that was built in less than 2 weeks. We should say it'll start off with 500 patients this week and move slowly towards 4,000. And yes, Sir Patrick Vallance, the Chief Scientific Advisor, has said that Britain is not in a fast acceleration phase with cases. It's following France rather than Italy. But you talk to people on the front line and there is intense pressure. Staffing is a problem, as we've heard. 1 in 4 doctors off sick, according to the Royal College of Physicians, or self-isolating. They say it's very, very difficult, particularly in London. The situation for staffing is getting worse in Birmingham. And as one source put it, normal wards are turning into COVID wards now. So you can build new hospitals, bring back volunteers, people who've retired, nurses and doctors and so on. But staffing them, I think, is going to be an issue, particularly with very anxious staff and those off sick as well, who want to come back, would like to be tested, but that's not happening, with the peak maybe only a few weeks away.
OK, Hugh, thank you.